Welcome to Up Level, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. Hello, and welcome to this week's episode of Up Level, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna Blasi, and what we are going to talk about today is sleep. Looking at what we've already discussed, we talked about nutrition last week. We've talked about stress management, and these are really intertwined with sleep. When we're not managing our stress, we don't sleep well. When we don't sleep well, we can't manage our stress very well. When we don't eat well, we often don't sleep well. If we don't sleep well, we often don't eat well. So you can see the way that these are intertwined and the cycle, really a vicious cycle that can happen when we don't have good sleep. This is why sleep is a hot topic in health, because there's ongoing research that links sleep with immunity, mental health, metabolism, sexual dysfunction, overall longevity. And so sleep is really vital for our energy, our mood, our metabolism, our brain health, and really the choices we make. As I said, it's harder to make healthy choices, to move our bodies, to eat healthy food when we're sleep deprived. We also tend to not be in the best mood, and then we might start beating ourselves up because we're snappier with the people that we love. So today I want to discuss how modern challenges like stress, screen time, hormonal changes, all of these things disrupt sleep, and particularly for midlife and menopausal women. Up to 60% of menopausal women experience sleep disturbances. It's somewhere between 40 and 60%, and many normalize the issue or fail to even report it to their healthcare providers. I've said in the past, we get used to the status quo as if it's normal to have PMS, and it's normal to feel like crap in midlife, and it's normal not to sleep, and it's normal to have headaches all the time. These things might be common, but they're not normal, and it doesn't have to be this way. So sleep issues significantly impact quality of life, and they increase our risk for cardiovascular disease, metabolic disorders, cognitive decline, and Alzheimer's. So first, let's talk briefly about the science of sleep and its impact. And I'm going to keep it fairly high level. I don't want to go into the details about the various sleep cycles, but we should know that deep sleep releases growth hormones, and these allow for tissue repair and muscle growth. So if you're working out, it's important to sleep well. That recovery time is really important. Sleep strengthens the immune system and produces immune-fighting cytokines and other chemicals and such that help our immune system. So when we're sleep deprived, we're more prone to infections. We're more prone to getting sick. And I would add to that what I said earlier, when we're sleep deprived, we don't eat as well, which also adds to this cycle of getting sick more often, etc. Sleep regulates blood pressure. It restores our energy reserves. It also has a really strong role in brain function. All right. Sleep, our REM sleep processes memories, enhances learning and problem solving. Sleep flushes out waste products that actually are linked with Alzheimer's. And poor sleep increases stress and our ability to be emotionally regulated. Let's look next at some of the common causes of poor sleep. Hormonal imbalances are a cause. Stress and cortisol dysregulation, and cortisol is another hormone in the body. And then there's underlying health conditions and lifestyle factors that affect our sleep. So looking first at hormonal imbalances, I talked about the prevalence in menopausal, perimenopausal, menopausal, postmenopausal women, huge prevalence in sleep issues. And for all of us, as we age, our sleep tends to decline. And so for menopausal, perimenopausal women, fluctuations in estrogen and progesterone affect our sleep cycles. Progesterone can help with restorative sleep. So when we're looking at solutions a little bit later, we'll talk about the role that hormone replacement can play. Then we have hormones like cortisol, our stress hormone. So the chronic sleep will keep your cortisol elevated, which will affect your sleep. And so a lot of people are in fight or flight mode, or maybe their cortisol spikes in the middle of the night because they're hypervigilant and they wake up with anxiety. And screen time before bed suppresses our own natural melatonin production. In fact, I read a study years ago that showed that outside light, like a light outside your bedroom window, for example, can disrupt your sleep, your natural melatonin up to 50+% suppressing melatonin. So when we look at solutions, we're going to talk about how do we offset this. And I did a whole episode on stress. That's obviously a key factor as well. It's really important to make sure that you don't have an underlying health condition. So let me preface this whole episode and say that it's important to get a proper workup. It's important, for example, if you're looking at hormone therapy to adjust your sleep, to work with a practitioner that's well-versed in menopausal hormone therapy or hormonal replacement therapy, as it was previously called. It's important to get a full workup from somebody that can look at your whole history as well as any underlying causes through lab work and other methods. So obstructive sleep apnea, most people just refer to it as sleep apnea. This is also more prevalent later in life, but it is highly undiagnosed in women. There is a very large percentage of women who have sleep apnea who don't realize it. And sleep apnea is linked to heart disease. Sleep apnea and other sleep disorders are linked to sexual dysfunction. I just saw some study. I didn't read it, but there was a study that was just out recently about erectile dysfunction in men, and how when they treated their sleep apnea with a CPAP machine, for example, it was more effective or as effective than Viagra. Again, I don't have the details on that because I didn't go look at the study. I just glanced at it, but we want to get this treated. And interestingly, a lot of people won't treat their sleep apnea because they don't like the CPAP machine. And continuous use, quote unquote, continuous use of your sleep apnea machine was actually just 4 hours a night. So 4 hours a night, even just 4 hours a night before you maybe rip it off your face, benefits your health, lowers your cardiovascular risk, and the other health benefits that come from addressing sleep apnea and sleep disturbances. Other underlying health conditions, thyroid issues. Now, thyroid issues will affect your sleep. They will also cause you to be tired, even if you're getting adequate sleep. Anemia, similarly. So if you're getting a lot of sleep, but you're still really tired, we want to make sure, and with every patient that I work with, I want to look at their thyroid and make sure they're not anemic as well, because as I've said previously, quite a large percentage of men, but especially women, are actually anemic without realizing it. Metabolic assessments, therefore, and doing comprehensive blood work can really help identify any contributing factors, especially in patients who are struggling with weight changes or low energy, which could be related, as I said, to some of these other things. And then lastly, lifestyle. And that's what we really want to focus on today. I want you to leave with action steps that you can do without a practitioner. And that's what's lifestyle factors, irregular sleep cycles, irregular sleep schedules, I should say, sedentary habits, poor nutrition. All of these contribute to sleep problems. Now, before we go into those actionable steps, I just want to highlight again the risks of poor sleep. It does matter. Let's not downplay when we're not sleeping well. Poor sleep can be trouble falling asleep, trouble staying asleep, disrupted sleep. And so all of these things can increase our risk of cardiovascular disease, type 2 diabetes, depression, weight gain, hormonal imbalances worsen, and this affects stress. This affects our menopausal symptoms, cognitive decline, memory issues, and reduced emotional resilience, to name a few. And I guess I should add sexual dysfunction, which I mentioned earlier. So what can we do about it? What are some actionable steps for better sleep? One, let's optimize our hormones and our health. So as I mentioned, let's do proper screening. So proper workup with a practitioner who listens to you, a practitioner whom you trust, including checking your thyroid, checking your iron levels, checking your ferritin. I like to look at, just as a side note, and I'll do a separate episode on labs, but I like to look at ferritin, iron, and the percent iron saturation because we can catch things. If you just look at iron, you may not catch it. If you just look at ferritin, it could be high because of inflammation. Ferritin's a marker for inflammation. So if it's over 100, that could be inflammation, and you still could be iron deficient. We look at percent saturation. That's where we're really going to start to see, oh, your percent saturation is low, and that's why you're fatigued. That's why you're not feeling well or having anxiety, losing your hair. There's so many problems that can come from being iron deficient and having anemia. Number 2, hormone therapy. I mentioned this briefly. Hormone therapy, so we have disrupted sleep in menopause due to declining hormone levels, such as progesterone and estrogen. Our insulin is changing, our cortisol is changing, like a lot of our hormones are changing, but estrogen gets erratic, especially in perimenopause, and then declines after menopause. Progesterone is declining. And so both of these affect sleep. But if you're having menopausal symptoms, such as hot flashes, that's a huge disruptor of sleep. So estrogen can be very effective for this. And I want to say, when I'm referring to estrogen and progesterone, I'm referring to estradiol. All right, that's where the primary research has been done. Years ago, we were putting everybody on biased. The research is not there for biased, it's there for estradiol. And because I prefer and feel that the research supports, at least the level of research we have, bioidentical hormones, I'm using estradiol and micronized progesterone. Now, if for personal history of cancer or other reasons, estrogen is not an option for you, we have found that progesterone alone benefits sleep. It actually benefits hot flashes and some other symptoms associated with menopause. If you have a uterus and you're put on estrogen, you must be put on progesterone. Okay, so if you're put on estrogen and you don't have a uterus, you don't have to go on progesterone. You may choose to for some of the other benefits, but you don't have to. Let me just clarify. I hope I just said, if you don't have a uterus, you can be put on estrogen without progesterone. You might be put on both, but you don't, quote unquote, have to. If you don't have a uterus, if you do have a uterus, then you have to be put on progesterone as well if you're on estrogen. So you do a risk-benefit ratio with your practitioner, which again, I highly recommend going to someone who's well-trained in menopausal hormone therapy. Are you a good candidate for hormone replacement therapy, or we just call it hormone therapy, or MHT, menopausal hormone therapy? Go on estrogen. If you have a uterus, you have to be on progesterone to protect your uterus. And that's basically 100 milligrams has been shown to be protective. The oral progesterone, the oral micronized progesterone that you take at night, has a sedative effect without the grogginess and kind of sedation that comes with medications, right? Medications for sleep can disrupt your day after. Progesterone, not likely to do that, especially at a lower dose, but it works completely differently than a lot of those medications. And if you, for whatever reason, are not interested or not a candidate for taking estrogen, and I will do a whole episode on this so we can bust some of the myths around hormone therapy, you could just try progesterone for your sleep. It's not as studied, but there are studies, and I've definitely seen in my clinic it be very helpful for sleep. So proper screening, hormone therapy potentially. When I get into the lifestyle pieces, I want to make note that hormone therapy, ideally, you still need these other pieces. Hormone therapy is not the magic bullet. I mean, a lot of women benefit from it, but let's still eat healthy and move our bodies, etc. And when you eat healthy and move your bodies, a lot of the sleep disturbances could go away, could come into balance, as could your vasomotor symptoms or your hot flashes. And so I like to put these foundations in. I talked about the 4 pillars of health in my first episode. I like to put these foundations in and then see, is hormone therapy indicated based on your whole picture, your clinical history, and how you're doing when you're healthy. It's just one way to approach it. That's how I like to approach it. If someone is already on hormone therapy, or it's just so severe that hormone therapy is really strongly indicated, then I still want to put these pillars in so we can get the best overall health and longevity. There's a lot of current trends, right? sleep is a hot topic right now. There's sleep trackers. You hear about all these different supplements. There's blue light blocking glasses, etc. So I will just say briefly about sleep tracker. I have my Aura Ring for those of you that see me on the video here on YouTube. I love my Aura Ring, but what we measure, we can manage. Let me say that. That's the benefit of trackers, but it can also get obsessive, just like a scale, right? We can get obsessed with the numbers and not be in tune with our intuition and what our body feels. When I was teaching fitness classes regularly, sometimes I'd wake up and I'd check my Aura Ring and it'd say, you need to recover and your body's not in a good state. And I felt really great. And then there were times when I didn't feel great and my Aura Ring said, you're ready to go. So we still want to listen to our bodies and not give our power away to these trackers. They're also not 100%. They have limitations. They can offer valuable insights into sleep patterns, but they're not a substitute for, in my opinion, our own intuition or for a proper clinical assessment. All right. So just beware, interpret the data with caution. And I love looking at mine because when we don't sleep well, not only do we get less deep sleep, less REM or REM sleep, but we also, our heart rate variability is lower. And a healthy heart has more adaptability, more variability. So that number would be higher. And I've had times where I didn't get a good night's sleep and my Aura Ring would say, hey, is there anything you did differently last night? And I'll say, oh, I had more sugar. Like I had more sugar last night. And then it will say, oh, X percentage, and it's a high percentage of users report that their sleep is not as great when they have sugar or this day of the week or when they've had alcohol. And I touched briefly on some of the issues around alcohol last week. But so there's no healthy level of alcohol. We have to understand that. It is a class 1 carcinogen. It is toxic. There's a linear relationship between all-cause mortality and various diseases with how much we drink. And even 1 drink a week increases our risk. But in menopause and perimenopause, it affects our sleep greatly. And so if you're having trouble sleep and you're still having that glass of wine or 2 glasses of wine at night to relax and help you sleep, try without it because it's not doing you any favors. We want to build a sleep supportive lifestyle. These are those foundations of health that I always come back to. And that even if you're on hormone therapy, I really recommend you build these foundations in. So exercising regularly and avoiding vigorous activity too close to bedtime. So while exercise is great, and if you're having trouble sleeping, if you increase your more intense, vigorous activity earlier in the day, morning or early afternoon, this will likely help your sleep, but also knowing that within 3 to 4 hours of bedtime, vigorous activity can adversely affect your sleep, making it hard to fall asleep, for example. The benefits of exercise on our sleep are irrespective of weight loss. So if you have sleep apnea, for example, and you lose weight, or I like to say release weight, because then you leave it off permanently. You don't have to go looking for it with your subconscious mind, which is a topic for another time. If you have released or lost weight, that will help your sleep apnea. Like losing weight is great for your cardiovascular risk and your joints, often your menopausal symptoms, not always, but in overweight and obese women, menopausal symptoms are greater. So there are benefits of weight loss on sleep, but exercise benefits are irrespective of losing weight. So you can be moving your body, exercising, and it can benefit your sleep, even if you haven't lost a pound. All right. This is also true for diet. So the benefits of diet on sleep, not eating a big meal, rich meal late at night. And again, back to the Mediterranean diet. We spoke of it last week. Every topic I study, Mediterranean diet, longevity, weight management, diabetes, mental health, menopause and perimenopause, more plant-focused Mediterranean, and sleep is no exception. Adopting Mediterranean diet benefits your sleep. So again, focusing on vegetables, fruits, whole grains, legumes, nuts, olive oil, and if you eat fish, fatty fish, that ideally is mercury-free and has been checked for other heavy metals. That's harder and harder to find these days. And then avoiding heavy meals, alcohol, and caffeine late in the evening. These changes, this diet will benefit you across the board and will benefit your sleep, regardless of whether or not you lose weight. And if you lose weight from eating healthier, you'll also have those benefits. We want to improve our sleep environment. Keep the bedroom cool, keep the bedroom dark, keep the bedroom quiet. Minimize screen use before bed. A lot of guidelines will say 1 to 2 hours. I try to be a little bit realistic with people because if they're watching TV or on their screens right until bed, let's start with 20 minutes before bed. You turn off all of the screens, or half an hour. And then if you get that, maybe you can work up to an hour. You can also use blue light blocking glasses to help offset, but I would still recommend you put the screens away and have that quote unquote sleep hygiene where everything's getting dimmer, you're starting to calm down. If I do banking before bed, forget it. I'm not going to sleep. So it's like, let's put the office away a couple of hours before bed. Let's stop working and ideally get off screens altogether. Now, I've said in other sleep talks, if you like to relax and watch a Netflix show with your partner or on your own, and that helps you relax before bed, that's fine. If it's not affecting your sleep, if it is, maybe see what it looks like to scale that back and do it a little bit earlier, and then have a little break, half hour, 20 minutes before bed, where you do something else, take a warm bath, do some stretching, some yoga. And ideally, it's not a crime show or a thriller, right? It's something calmer. And that's one of the things I love about my Aura Ring is I can look and see when I'm getting into bed, am I in a restored state, or am I still engaged, or worse, am I in a stress state? Which brings us to our next point, stress management. We want to practice mindfulness and deep breathing, progressive muscle relaxation. When I was in college, I was taught progressive muscle relaxation. And so what that looks like, or at least my interpretation of it, is when you're lying in bed, start at your feet. You're going to work your way up to the top of your head, and you are going to squeeze and release every part of your body that you can think of, basically. So start with your toes, squeeze and release, and then your feet, squeeze and release, and then your ankles, squeeze and release. And obviously there's an overlap. To get your ankles, to get your feet, you're doing your ankles, and then your calves, your knees, your thighs, your glutes, your abs, and then your hands, then your arms, and your shoulders, and even your face. Just squinch. This is the fun part for those of you watching the video. Squinch everything up and then release it. I like to include breath with it, but you don't have to, where right before you squeeze, you inhale, squeeze, 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 and then you exhale and release. When I was younger and I had insomnia, I did this, and I would often be asleep before I got all the way up to the top of my body. It's a bit like getting a massage, getting the muscles wrung out. So that's something that you can try. But really, any calming pre-bedtime routine, journaling, stretching, gratefulness, gratitude is wonderful. And so sleep hygiene is stepping away from screens for 20, 30, 60 minutes before bed, doing something calming, getting into a state of gratefulness, doing some journaling, taking a bath with maybe Epsom salts for that extra magnesium, and anything else that you find relaxing, which is usually not working, not scrolling on Facebook, and not, as for me, doing banking. And then let's look at evidence-based sleep tools. If you have chronic insomnia, one of the most proven techniques is cognitive behavioral therapy, specifically for insomnia. So all I will say is, try these other things, make sure there's not an underlying cause, get a full workup, but do know that if you go see someone or get a course or something that specializes in CBT for insomnia, it has been proven effective, and it's kind of the gold standard for treating it. Supplements vary, the evidence varies. When we look at the assessment piece, always have your vitamin D assessed. And if your vitamin D is low, taking vitamin D can help with sleep, among many other things. So I'm always checking people's vitamin D, and a good safe supplementation for most people is 2,000 IUs. They've changed it to micrograms. I don't remember what that number is. And if you're deficient, going higher than that and replenishing. Melatonin can be helpful. The research is a little mixed. And I think one of the reasons the research is mixed is because melatonin will help you if you're not deficient in melatonin, right? But if you have something that's causing you to be deficient in melatonin, it could be helpful. And that's why probably 50% of the people I talk to, melatonin has been a game changer for me, and other people, melatonin doesn't work at all. It's not going to work if you don't need it, but it can help when you do. And there are definitely people out there that find melatonin really helpful. Melatonin does have some other benefits, so it's definitely indicated to try in this situation. There's some research on valerian. Again, there's a lot of calming herbs that could potentially help you with sleep, especially if the sleep issues are stress related, as opposed to an overt hormone issue that's not directly related to stress, although stress affects all of our hormones and our hormones affect our stress. If you've tried valerian, let me just make a note really quickly. If you've tried valerian and it didn't work, there is, I think, about 10% of the population that has what we call a paradoxical reaction to valerian, where they have the reverse effect. So instead of it being calming, it's stimulating. So just be aware of that. And then magnesium glycinate. The research on this is a little mixed, but certainly in my patients, I see magnesium be helpful, and magnesium is great for stress. Ashwagandha, some things like magnesium glycinate or ashwagandha for relaxation and stress reduction could be beneficial. And lastly, let's adopt those healthy sleep habits. Wake up at the same time daily to help set your circadian rhythm. Waking up at the same time daily and going to bed at the same time can really help with our sleep patterns. The more regular we can be with the wake time and the sleep time, I will often reverse engineer my day of how much sleep I think I need to get based on, what time I need to go to bed to get the sleep that I want based on what time I'm starting in the morning. And being regular with that is really helpful. Avoiding naps or limiting them to the true power nap, the 20 or 30 minutes earlier in the day, so then you're not disrupting your sleep. And reserve your bed for sleep, intimacy, and illness. Let's not work in our bed. Let's not work in our bedrooms. I always tell people, ideally, let's not have a television in your bedroom, but really reserving your bed for sleep, for sex, and if you're sick. The 3 S's, that's what your bed's for. All right, so to close out, I'm just going to recap. Sleep is a cornerstone of health. It requires a holistic approach, which is true, in my opinion, of just about everything requires a holistic approach, because it's just going to be more effective when we come at it from all the proper angles, all the way from workup, looking at labs, to all the lifestyle pieces, to are things like hormone replacement or even other medications, when are they indicated? So let's really value the importance of prioritizing our sleep as a cornerstone for health. And as always, I do want to encourage you, just make small, sustainable changes. We talked about a lot today. Small, sustainable changes compound over time. This is how we build better habits over time. This is not meant to overwhelm you. So I'm going to encourage you, take one small, actionable step today, like creating a bedtime routine or focusing on dietary changes. And share your sleep tips or your personal sleep hacks or questions on social media with us and within our community, so we can share what has worked for you of what I've talked about today, what has not worked for you. Again, just because it didn't work for one person doesn't mean it won't work for you, but those are just some overall tips. And thank you so much for spending your time here with me. I look forward to hearing from you on social media. And if you loved this episode, please share it with your friends, leave us a rating, a review. Remember to subscribe so you don't miss an episode. And I will see you next time. Thanks so much. Here's to up-leveling your health. Thank you for joining me on this episode of Up-Level, Real Health, Real Talk. I hope today's conversation inspired you to take the next step in your health journey. One that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.